All right, let's talk about something in men's health that is way more common than you'd think, but almost nobody wants to discuss it: urinary control. We're going to break down this whole challenge with some clear, simple, and honestly, really helpful information. So let's just dive right in.
So, does this sound familiar to you? You've just gone to the bathroom, you think everything's done and dusted, you zip up, and then a couple of extra drops decide to show up uninvited. It's such a small thing, but man, can it be frustrating. The good news? It's a totally solvable problem.
So first up, let's tackle the unspoken dribble problem. We're going to give this thing a name, because once you know what you're dealing with, finding a solution gets a whole lot easier.
That frustrating little issue actually has a medical name. It's called post-Micturition dribbling. And here's the thing, the cause is super simple. It's not some complex medical mystery. It's literally just a small amount of urine that gets left behind in the urethra after you thought you were all finished.
Now, this after dribble thing, it usually doesn't show up alone. It's often part of a bigger picture that doctors call LUTS, or lower urinary tract symptoms. You can think of it as a whole family of symptoms, like suddenly getting a super strong urge to go, having to pee all the time, or noticing your stream just isn't what it used to be.
And, this goes way beyond just physical discomfort. It can really mess with your confidence and can even impact certain cultural or spiritual parts of your life. For instance, in Islam, maintaining purity and cleanliness for prayer is absolutely essential. So a condition like this can create a real practical challenge. It just goes to show how deeply this can affect someone's day-to-day.
Okay, so we have put a name to the problem. Now let's get down to the nitty-gritty. What's actually causing this to happen in the first place? Let's get into understanding the root cause.
Okay, so here's the deal. The core of this issue, 9 times out of 10, it's all about your pelvic floor muscles. These are the muscles that basically form a sling to support your bladder, and when they start to lose their strength, your control just isn't what it should be.
So you're probably asking, well, why do these muscles get weak in the first place? It usually comes down to a few common reasons. Things like prostate surgery, just the natural process of getting older, carrying extra weight, or even something like a chronic cough that puts constant strain on that area. All right, we get the cause, but what can you do about it, like right now, for immediate relief? Let's walk through a super practical technique you can start using today, an immediate relief technique. This is called the urethral milking technique. I know, it sounds a little clinical, but trust me, it's incredibly simple and it works. So, after you've finished urinating, just pause for a second, then take your fingertips, place them behind the scrotum, and apply a little bit of gentle pressure, moving upwards and forwards. That one simple move helps push out any of that leftover urine. It's a total game changer you can use immediately.
Now, a quick fix is awesome, but for a real, lasting solution, we need to go back to that root cause. And that means building long-term strength in the muscles themselves. This is where we talk about Kegel exercises.
But here's the million-dollar question, right? It's the one thing that trips everyone up at the beginning. How do you even find the right muscles to exercise? It's not like flexing your bicep. And this is the absolute best way to figure it out. Next time you're using the bathroom, try to stop the flow of urine midstream. Feel that? The muscles you just squeezed to do that, boom, those are your pelvic floor muscles. Once you've felt that, you know exactly what you're targeting.
So how do you do the exercise? It's a really simple rhythm. You squeeze those muscles you just found, and you hold that squeeze for about 3 seconds. Then, and this is just as important, you completely relax them for another 3 seconds. Now, 2 crucial tips. Keep breathing normally, don't hold your breath, and make sure you're only squeezing your pelvic floor, not your stomach, your thighs, or your butt.
And just like any other workout, consistency is everything. So what's the magic number? 3. Just remember the number 3. You're going to want to aim for 3 sets spread out across your day.
And in each of those 3 sets, you're going to shoot for about 10 to 15 repetitions. And you know what the best part is? Nobody has to know you're doing them. You can do a set while you're stuck in traffic, sitting at your desk, or even waiting for your coffee.
Now, beyond strengthening the muscles, there's another amazing tool called bladder training, and the key to unlocking it is this powerful analogy of the urge wave. That sudden, intense need to pee, it's like an ocean wave. It builds up, it hits a peak, and then, if you just wait, it naturally starts to go down. The secret is to stop fighting the wave and instead learn how to surf it.
So, the next time you feel that wave start to build, that overwhelming urge, don't just bolt for the bathroom. Try this instead. Sit down and take 5 slow, deep breaths. Do 5 quick little Kegel squeezes that sends a hold-on signal to your bladder, or just distract your brain. Seriously, count backward from 100.
more often than not, you'll feel that urge just fade away. You're back in control. Okay, these self-help techniques are fantastic. They really are. But it is absolutely critical to know when you need to put them aside and go talk to a doctor. So let's talk about knowing your red flags.
Look, these are the non-negotiables. If you ever see blood in your urine, if you keep getting infections over and over, if you have any reason at all to suspect cancer, or if you've had a scan that shows you're not emptying your bladder properly, you need to see a doctor. No exceptions. These can be signs of something more serious that needs professional attention.
So, after all that, what's the one thing I really want you to walk away with today? It's this simple but powerful idea. Control is possible. You are not stuck with this. But you've got to remember, this isn't an overnight fix. Patience and consistency are your two best friends on this journey. The small things you do every single day, those sets of Kegels, practicing riding the urge wave, they all add up. It might take a few weeks, maybe even a couple of months to really notice a big difference, but that difference will come. So, I'll leave you with this one final question. With everything we've just talked about, what is the first step you're going to take today? Maybe it's just trying that urethral milking technique once. Maybe it's doing your very first set of Kegels. Whatever it is, just remember that one small action today is the beginning of a huge positive change.